Hey, this is Misty, and I just want to share a little bit about my journey so far with Pectus Excavatum. So I'm actually having surgery next Tuesday, which is like 6 days away, and that's all come on rather quickly, but my story actually started probably 35 years ago. And this is something I want to share because I feel like a lot of women don't even realize that they have Pectus excavatum. So, what this is, I'll just call it PE, is it's a sunken rib cage. So, basically, instead of your rib cage going out like this, it's caved in and it's caused by an overgrowth of cartilage. So, oftentimes it comes on during a growth spurt. And so a lot of people will start noticing it during puberty. So you can get it sooner. Babies can have it. It is a genetic thing. And so my daughter actually has it as well. And we're currently working on getting her surgery as well. We have a date scheduled in 4 weeks, so 3 weeks after my surgery. We're still just deciding for sure if we're going to do it just yet. So with Pectus excavatum, it's really best to get the surgery around like puberty time. So before you have that big growth spurt and while your rib cage is starting to harden more and all of that. And so she's at the perfect age for a girl to get that. I think with boys, they prefer to do it a little later. And that is because the surgery involves putting metal bars into your chest and like popping your rib cage back out. And you keep those metal bars in for about 3 to 3.5 years. And so if you start too early, the boys tend to have their growth spurt a little bit later. And so if you start too early, they might get the bars out and then still be continuing to grow, and they'll have a regression with the deformity. So she's actually at the perfect age to do it, but we're just kind of deciding if we feel that her the severity is enough and the symptoms are bad enough, and all the things are coming together timing wise and all of that, or if we think we should just wait a little bit and see if her symptoms get even worse. We do both register in the severe category for this deformity. The reason that women tend to not notice it if they didn't catch it like around that age of puberty is because it's kind of like hidden behind your breast. Basically, like you have more breast tissue and fat in that area. And so you might just think you got some extra cleavage or, you might just not really notice because it's kind of hidden behind there. So in my case, I did know I had a sunken rib cage. I don't know what age I was when I realized I had that, but I do know that around age 11, I started really having a lot of breathing difficulties, and that was attributed to asthma. So I was told I had asthma. At some point, I think I mentioned my rib cage, or a doctor noticed it. I'm not sure. But I was just told it was cosmetic and doesn't cause any problems. And personally, I didn't think that cosmetically it looked weird. It's not super asymmetrical. It doesn't look as deep as it actually is. And so it wasn't bothering me. And, I was at this age where I was a kid and you just believe everything your doctor tells you, right? So, okay, it must be cosmetic. And we didn't have internet back then. I mean, I'm old enough that we didn't have internet in our homes back then. And so that's just kind of like how it was. I didn't have resources. I didn't have support groups for it. I didn't have access to information like there is now. And when I kind of like was reevaluating my breathing issues in my 30s after, having kids around that time, I really just I was like, you know what? I have babies. I don't want to do this surgery. That sounds crazy, putting metal bars in your chest. I have tiny babies. I don't want to do that right now. And I kind of brushed it off, and I didn't realize until more recently, having a lot of aha moments, I guess. I didn't realize that mine was so severe. I really still was attributing most of my symptoms to asthma. Looking back, I realize now that a lot of my symptoms probably are just from the Pectus excavatum, and I probably was misdiagnosed with asthma. I may not even have it, and so that's kind of crazy to me, but it definitely has affected me over the years. I've noticed when we go hiking, I can't keep up. I can't breathe. I definitely just don't have the stamina. I've never been able to tolerate cardio. When I was 11 and started noticing my breathing troubles, we were in gym class trying to run a mile, and I just could barely do it. I thought I was going to die after I ran a mile, right? Like I just could not breathe. And, it was like way in the back with all the, the slow kids. And I was like, why am I so slow? Like I'm skinny. I'm not that unathletic. Like I should be able to just run a mile, right? So, that was one of my symptoms. I've never been able to tolerate cardio really much at all. Also, when I was pregnant, I would have issues where like I couldn't stand for more than 5 or 10 minutes without feeling woozy. And I never really knew what that was from, but now I know it's probably from this. Also some weird things that would happen when I tried to sleep on different sides or on my back or whatever, it's just things were getting compressed in there. And I didn't even 100% realize it was from my rib cage. So obviously logic will tell us if your rib cage is poked inward that it could be compressing your heart and lungs. But I've never had a scan. I've been brushed off my whole life about it. And I've always told it's not an issue, right? So anyway, fast forward to recently, I have had more weird symptoms like heart palpitations or like heart fluttering, feeling like my heart's beating out of my chest. I'm literally just sitting here doing nothing and I'm feeling short of breath. So I felt that my symptoms have worsened over the years for the last couple years as well, since the first time I had COVID. So it could be a long COVID symptom or it could just be related to my lungs having to work so hard. But for the last few years, like maybe 5 years, I've felt like I have a chest cold. Not all the time, but so it comes and goes. But I'll feel like I have a chest cold when I don't. And that's been really weird. Sometimes I feel like I have like a girdle wrapped around my ribs and like it's just very tight. I went a lot of years where I was just like wheezing every night, and I thought that it was my asthma being triggered by my allergies. And that's possible, but there's also a likelihood I don't actually have asthma. So it could have been my allergies tied in with my lungs not being able to expand and contract fully, basically. So anyway, I started looking into it again this last few months, and I decided that when I had my annual physical, I would ask my doctor about it. I had a different doctor this time, and I was like, let me just ask about it. And she actually said, you know what, let's get you an x-ray and we'll get the diagnosis, because you obviously have this, but let's get the diagnosis. And so I went and got the x-ray, and that led to orders for a CT test to assess the severity and get what's called the Haller index. The Haller index, they basically measure how many times the depth of your rib cage can go into the width of your rib cage. So mine is 4.1. Unfortunately, the orders or they just decided to measure it on inhalation. So they got the CT scan on like while I was inhaling instead of exhaling. And actually it will tend to show up worse when you're exhaling because everything kind of caves in. And that's also like the reason why a lot of people with Pectus excavatum have like forward shoulders, very slouchy, kind of slumpy, bad posture. Definitely me. So anyway, I don't have the true measure of severity, but severe is like over, I think it's 3.25 and above is considered severe. And there are people that have it worse than me, but I do fit into that severe category. And there are people who have it worse than me and don't even have any symptoms. But the scan definitely shows that my heart is compressed, kind of like bean shaped, and it's not supposed to be. It's supposed to have some extra room in there. So yeah, I found out it was severe, which was like a little bit shocking because it doesn't look that bad to me, so I didn't think it was that bad. And so I went on a journey. I went on a journey through Google and also using AI a lot to help me just kind of make sense of test results I've gotten and whatnot. And I found out that the best doctor in the world who treats adults is in Phoenix, just 2 hours away. And so that really felt like such a God thing since, I didn't grow up here. Like we moved here when my daughter was born. So she wouldn't have even been an option like when I was 11 or 13 or, whatever. And so surgery has also changed a lot over the years. So if I had had the surgery back then, I probably would have been given one, I can't remember if I mentioned this. The surgery involves putting metal bars in your chest and popping it out. Yeah, I did mention that. So I probably would have just got one bar. I wouldn't have had as good of a result, and I would have had a lot more pain because the pain management has improved and the techniques have improved over the years. And so now they do like a nerve freezing, and it helps you kind of get through that initial few weeks where the pain would be really severe. And so it's yeah, definitely the surgery has improved. That is a blessing to me, although I do kind of wish I had had this surgery 30 years ago or more. It is what it is, and I'm glad that there are doctors who will treat adults, because there was a time, I believe, where like nobody was treating adults. There were very few doctors in the world who would even do this for adults, and the reason is because our rib cages are harder. They've developed techniques now to help with all of that. Not that they can change your rib cage in that way, but they actually have a crane that helps lift up your sternum now. They're doing the metal bars. There's another technique called the ravage technique, which is not what I'm doing. My doctor really doesn't even think most people need it now with the evolution of the surgery I'm having, which is called the Nuss procedure. But in the ravage, they can do things like cut your rib cage, cut your cartilage, like kind of reshape things with your rib cage in order to make stuff work. And that just doesn't sound very fun. So I'm just really glad and grateful for how the surgery has evolved over the years, and that we have such great access as far as my daughter Inara is concerned. Phoenix Children's Hospital works very closely with my doctor, who's at Mayo Clinic, and they all are just very interested in advancing things in this field. I know Phoenix Children's is actively testing out some different type of pain management, and they're all trying to work to better this field and really help people who've been ignored a lot over the years. And I just really appreciate that. So some of the best doctors in the world, in the country, are right here in Arizona, and that's such a blessing. So anyway, I did have 2 other surgeries this year, and I had a umbilical hernia surgery and a meniscus surgery for my knee. And the meniscus surgery I'm not fully healed from. They said it would be about a year for me because my meniscus was mushy or soupy, he said. And he did a lot of stitches very close together. I actually found someone who's the best surgeon in the world for meniscus surgery, who was in LA, and I did the surgery there with him. And any other surgeon would have just clipped it and sent me on my way, or I don't know. I don't know what they would have done, but it could have been a much easier recovery. But long term, I should have a better outcome of, lower chance of arthritis and knee replacement in like 5 or 10 years. So that's what we were shooting for. I'm not 100% recovered from that. So it's only been 8 months. I've been doing physical therapy. I'm doing what I can to get my knee back to how it was. I'd say I'm maybe like 85% of the way there. I don't have all of my range of motion back quite yet, but it has improved. And what else? Just like random like pains here and there, but really not that bad. I do also have some nerve damage that hasn't come back yet. I don't know if it will. It might be like that forever. It's just like my knee is a little bit numb in areas and feels kind of weird when I touch it. So, but yeah, I'm not 100% recovered. So I was thinking I would be doing the surgery sometime next year. My surgeon, told you she's the best in the world. So she's very busy. She's the only one that does the surgery there, and people come from all over the world to see her. She got a bit of a backup during, COVID times, and they just never have gotten back to where they don't have any kind of waiting list, I guess. So the typical process is you get on a waiting list to have a consultation with her. So it might take a few months before you, like 4 or 5 months before you could even have your first consultation. And then after that, it's probably like another 4 or 5 months or so before you would get the surgery. And really maybe a little longer for all of that, because most of the people that I messaged with online said it took a year to, like, from first contact to actually having their surgery. And so I kind of just had it in my mind that it would be next summer, probably when I had the surgery, which isn't ideal because you need to get out and walk and stuff after you do the surgery. And it's very hot here. And I'm thinking, I already have breathing issues. They don't necessarily improve, right? Like the first week or second week after your surgery. And so I was thinking, like, that kind of stinks to have to go outside 4 to 6 times a day and walk out in 100 plus degrees, while trying to heal your body. And so I was really kind of hoping I could at least do it in the spring. And I did ask them if they could put me on a cancellation list. Like, hey, I know I'm 2 hours away, but I will drive there any day that you call me and say, like, we have a cancellation. I'll do my best to make it there, right? And they said, we don't have a cancellation list for the for the consultations, but they do kind of like call people who they think might be nearby. And so I thought, okay, great. They're only going to call the people in Phoenix. But then I thought, maybe there aren't a lot of people in Phoenix right now on the, like, trying to be on the waiting list and all that. So anyway, I did get called a few weeks ago on a cancellation, and I did have my consultation last Thursday. I had lots more testing, and I got to talk to my doctor, my surgeon. Her name is Dr. Jaroszewsky, so everybody calls her Dr. J, and she's great. The Mayo Clinic has just been fabulous to work with. Her nurse Julia, came in and talked to us and gave us all the details about the procedure itself, which, of course, I'm a Googler, so I've already watched Dr. J do this surgery on YouTube. So I'm like, I don't know everything, but I know enough to know. And I actually felt more confident after watching that video. And the way that she talks and how confident she is in her own skills. I know she's done, last I heard it was over 1,300 surgeries, so it's probably more now, but she knows what she's doing, and most of those were on adults. So the adult surgeries are a bit different, like I said, because your rib cage is harder, and you have different medications you have to take. The surgery is just a bit different. Inara, my daughter, should have hopefully a very different experience than I do, with better pain management even, and just like a less difficult, less long recovery is the hope. But anyway, so I had a bunch of tests and appointments last Thursday, and then I talked to Dr. J and I said, hey, how far out are we looking for surgery? And she said, oh, probably 5 to 6 months. And I said, I heard through one of my phone calls that I had done before, I heard that you might have a spot or two open in December, maybe with because it's holiday season, maybe people abroad are not wanting to book around that time, or people who come from out of state. So it's like, I heard you had some spots open in December. And she said, well, I might have one. It's like the day before, it's right before I go out of town for the holidays. And so I think nobody wants that day because I won't be here right afterwards. And I was like, I will take that if it's available. Please let me know. And so she said, I'll have Carla, my scheduler, call you. And she did. Actually, the next morning, bright and early the next morning, I got a call from Carla, and she said, I think we have a cancellation happening for November 4th. Would you like that day if we can get your insurance to approve it in time? And November 4th was like 11 days away. And I was like, yes, I would, even though that's kind of crazy. So I took it. I took the date, and my insurance did approve today, and we're good to go. So this is a long recovery. I will have metal bars in my chest for 3 weeks. And 3 years, probably more like 3.5 years. And I think, there's a lot of like pros and cons, and you just have to hope that the pros outweigh the cons. For those who are interested, like some of the things that might occur is like permanent numbness in your chest, in various areas across your chest, or even across your whole chest where the bars were, that kind of thing, which could be a big deal for some people. Also, I could have like chronic pain while the bars are in, it's possible that while the bars are in, I don't actually have an improvement in my breathing. My heart will have more space, but it may be that there's not an improvement while the bars are in, because the bars are kind of like holding your rib cage from really flexing as it should. So so that's possible. I may not even notice much of I mean, I might. I've heard plenty of stories where people do. They're like, I can breathe fully for the first time. And it's just amazing. And so I hope to have that moment, after surgery, sometime soon after surgery. What else? She also mentioned, this is something that I've not seen other people talking about anywhere. So hopefully this is helpful to somebody, but she did mention that there is an artery behind your sternum. It's like a mammary artery. And that is the artery that is typically first, it's like first choice if you need bypass surgery for your heart. And because the bars are pressing up against the sternum there, typically it makes that artery unusable. It damages the artery to where it's not going to be healthy enough to use for a bypass surgery. So there are other arteries that can be tapped into, I think like over by your armpits or something. I'm not sure, but that is a consideration. Like you just, it's one of those things, you don't need it until you need it. Like, I mean, I'm sure you need it, but you know what I mean? It's like, I don't know if I'll ever need bypass surgery, right? And so I don't know. I'm making a decision based on things I don't know, right? But since there are other arteries that can be tapped into, that is a good thing. And so I'll just have to trust that, it's just, if the time comes and I need it, then I'll have a different one to tap into. What else? So my daughter, she had her first appointment October 9th, and they have 10 surgeons there, I believe, at Phoenix Children's. And so it's much easier and faster to get in for appointments. Excuse me. And so anyway, she had her last test when I was in visiting my surgeon last Thursday. So she did her exercise test. She had already had a echo for her heart, and I'm trying to remember what the other test was. I can't think. I'm actually already on the medication for my upcoming surgery, and it's making my brain a little foggy. So I'm like forgetting words and things. But yeah, so anyway, she had all of her tests done, and she did her exercise test, and we just got the results from that this morning. So we're waiting to talk to her surgeon about the results from her exercise test. So I kind of want to see like how severely this is affecting her with exercise, because we did pull her out of school a couple years ago. So she's, or actually last year. So she's doing homeschool now. She doesn't have gym class, so she's not as active every day. She does like occasionally go out on a jog with my husband, or, she'll go to the gym with us, but she's just not on a daily basis doing a lot of cardio. So it's hard for us to see like how much this is affecting her. We do go hiking and stuff, but we really haven't done much of that since my knee surgery because I couldn't go. And so it's just really hard. Like she's saying, I get short of breath, or I feel like I can't do as much as other kids when we're playing or whatever. But I just I haven't seen that a lot. And I don't want to minimize her symptoms or like gaslight her. Like I kind of have been for my entire life. So I want to be like really more aware of how bad her symptoms are. I think that exercise test will help me understand, but we're just trying to give her as much information as we can so that she can decide, does she want to do the surgery now, or does she want to wait a few years, go through her growth spurt, and then consider doing the surgery. And the reason that we're kind of like being a little back and forth about it is because my surgeon, again, the best in the world, who used to do surgeries on children for a while before like specializing in adults. Now she does age 16 and up. She asked my daughter about her symptoms, and my daughter was kind of quiet about it, didn't really like speak up about all her symptoms. So there's that. But asked her about it, asked her about if, the deformity visually is bothering her, that kind of stuff. And then she just kind of was like, I wouldn't even recommend this surgery for her right now. And that was it kind of threw me for a loop, because I know she's at like that perfect age to get it done. But kind of what she's saying is like, you know what, her ribs won't be that much harder. She said, I would do the surgery on her, like I'd be happy to do the surgery once she hits 16 if you want to see like if her symptoms progress more. That being said, I don't feel like my daughter really correctly relayed what her symptoms are. I think she was just being kind of shy maybe. And so it's hard, like we don't know the severity. I don't think Dr. J understood how severe her symptoms are. And we're just kind of working with a lot of unknowns. That being said, like it's not affecting her a ton in just her regular daily life, because she's homeschooled and she's not, doing sports and all that. And so there is that side of like, do I take a child who seems very healthy and like go cut into them essentially, and, cause her potential like pain for the next 3 years, irritation, whatever. Now again, her recovery will be so much easier than mine because she's a child, but I mean, you just don't know what those symptoms might be. Okay, sorry, my husband was letting the dog out. We just don't know, what her symptoms, like how it's going to affect her in the future. Could they get worse over the next few years? Do we just go ahead and do the surgery now? Because it's likely they will get worse. It's likely she will become more active in different stages and phases of her life. And we don't want that to hold her back, that she's just not, capable of doing everything she wants to do. I don't know how much she's just choosing to not do certain activities because she knows that she'll have symptoms. Because I know that was the case for me. I like avoided all sports. Like anytime any sports were happening, I avoided it. I really like have never been able to run. I've tried a fefew times. Like one time I just tried to run and I made it like half a block and I felt like my chest was on fire, like being stabbed or something. I couldn't breathe. It was kind of crazy. I have been able to jog a little bit. But I definitely can't keep up. Like my husband and I used to try to go on walks/jogs together. And I mean, I just couldn't keep up with him at all. And I don't know how much that stuff will affect her over the coming years. Again, we do go hiking quite a bit normally when we're not recovering from surgeries. And, she's trying to keep up with her brother. I think she does get tired before he does. And, I don't know how much emotionally that will affect her as the years go by. For me, I was in public school, so I was always getting chosen last. Anytime we had to do something in gym class, I was the last kid chosen. Because I wasn't even physically capable of being good at any sports, really. And that did affect me mentally, emotionally, psychologically. That did affect me to always be chosen last, right? And she obviously doesn't have that happening so much now because she's at home. But, she has her own story that she's got to work through, her own journey. And so I know this got a little bit long, but I just wanted to share what's going on, partially as an update to our friends and family and whatnot. But also I just want to put this out there publicly because, again, there's so many people who don't even realize that they have this deformity, especially women. There are so many men that have it, and it does tend to bother them a lot, even if they don't have the symptoms. It can make them very insecure about their physique. There's so many situations where guys have their shirts off, and it can make people feel very self-conscious, and it really affects their sense of self-worth. And I would just say, if that's happening, go get your deformity measured and find a surgeon who knows what they're doing. Do not go to just some, let me tell you, I did go to my doctor, right? And we were talking about my results, and I had actually already got on the waiting list for Dr. J. And I told her, I found this surgeon, and she's up in Phoenix, and she's like the best in the world. And she was like, oh, can't you just go to somebody in Tucson? And I was like, no, I'm gonna go to the lady who's done this 1,300 times, specializes in adult surgeries, and is 2 hours away. Like, is the best surgeon in the world, and she's 2 hours away. Like, we're just gonna do that, okay? Thanks. So like doctors just don't know. A lot of them still think it's just a cosmetic issue, which I mean, logic would tell you it's not. That if your heart is crushed and your lungs are crushed, it's not a cosmetic issue. And so just advocate for yourself. If you think that you might have this, go get it checked out. Get that X-ray or get that CT scan so it can get measured. If you're a kid, it'll be probably an MRI instead of a CT scan because they don't want to expose the kids to the radiation. They just want to expose us adults. But go get it scanned and just start the process of talking about it. Younger kids have an option, and I know some adults have used this too, but it's called a vacuum bell, and it's like a suction cup that you put in the middle of your chest. The thing with the vacuum bell, so it like suctions, pulls out your sternum. The thing with the vacuum bell is it works best. This is just from my research, so feel free to do your own, but it's my understanding it works best for kids who are age 11 and under. And it's not necessarily going to be effective for everyone, but it works best when they're younger, again, because the ribs are less hardened, less calcified, and so it's easier to pull the ribs out and pull the sternum out. But it's something that they have to wear a lot. I mean, it's kind of, sorry if my video is bouncing a little bit, I'm in a rocking chair. It's something they have to wear a lot. Think of it as like almost like how with braces you have to wear them a lot to get your teeth to kind of stay in place. They keep, if you've ever had braces like the invisible ones, you know that like after you take that out, your teeth kind of shift back a little into what they were used to, and then you got to put the thing back in, and you feel it's like tight again. I would say it's kind of like that, right? So you have to wear it something like 8 hours a day, or like maybe longer. You have to wear it while you're sleeping would be probably the best time, but that might not be very comfortable to sleep in. So that may be an option for some people. It's something to look into. I have heard it can work for adults. I think my surgeon said for Inara it was maybe like a 30% chance that it would work for her and that she'd have to wear it a lot. So it could be an option if you don't want to do the surgery, but definitely look into it. If it's something that's affecting you, if you have symptoms, you have asthma or you think you have asthma, it might not be asthma. If you, you have shortness of breath, you have like fatigue, low exercise intolerance, any kind of heart issues, even digestive issues are tied to this. So, if you have like reflux, some like anything like that, I don't know, reflux, if you get full easily. So a lot of people with Pectus excavatum are very skinny. I think a lot of people think it's because maybe they don't quite eat as much because things are being compressed in there, and so they just feel full faster. I don't know if that's like a conclusive, study has been done on that, but definitely you can feel full faster. There's so many symptoms that could be from that you might not even realize are, like with mine. And so I just want to encourage you. This does happen. It's like 1 in 350 people, I believe, but I think that number is wrong because I think there's so many women that don't report it or know about it. And probably some men too who just maybe have minor pectus and they just don't realize it, especially if they are like they're working out at the gym, because if you build a lot of muscle in your pec area, it might kind of tend to like make the deformity less noticeable. So I think there's more people that have this, and they need to know about it. They need to know that there's something they can do about it if they're having symptoms. Now, if you have no symptoms and it doesn't bother you cosmetically, it's not necessarily life-threatening. It's definitely considered an optional surgery to do. And so surgery is not for everyone. It's going to be hard. It's going to be hard for us. My husband's mom is coming to stay with us for like 5 weeks. She's going to come a week after my surgery. And so we're going to have help. I think you need some support and help probably the first 3 weeks or so. And so since we have 2 surgeries happening in our house, she's going to come and support us in case I'm not able to help my daughter as much as I'd like, helping her wash her hair and stuff like that. So I'm very grateful that we have a support system. My mom lives 15 minutes away and, some other family. And so we definitely have people who can help us. We're going to work on freezer meals this weekend and things to prepare. And let me know in the comments if you want any videos about like what things are helping and, you know, what things I didn't actually need. Maybe after my surgery I could make a video about that. I'll probably try to do some more videos, some shorter ones of just my recovery as afterwards. But for now, yeah, I just wanted to get the word out. I wanted to share, and I hope that this helps somebody. If you do have this, you are not alone. There are Reddits for this, there are Facebook groups for this, there are Discord channels for this. Like, find a support group. Just start Googling, get all the information that you can so that you can make the right decision for you. It's not right to do it, it's not wrong to do it, right? It's just like whatever is best for you is the right answer here, and just get as much information as you can. Anyway, I will be having my surgery in 6 days, so if you'd like to follow my journey, be sure to subscribe and watch for those videos to come, and I'll see you in the next one.